what does it mean to oversee a portfolio of AI applications, whether it's from a security perspective, whether it's from an operational perspective, whether it's from an ROI and effectiveness perspective? How much of that, what does it mean?
The heart of concept of AI governance, where if you're going to be using AI to connect your entire enterprise, you're going to be permeating AI insights throughout the organization. You have to have an ability to monitor it the same way you monitor every other technology solution. And systems don't have that today. They have their Tableau dashboards, their Power BI dashboards that they're running the business on. And then they have these AI models running in this little corner of the shop, making critical decisions, but none of those outputs are being integrated into the patient's care pathway, outcomes, ROI. That's what we provide. We bring all of those AI results. We combine them with automated ground truth that our platform is able to generate off of the patient record. And then we actually incorporate all of that into the data strategy and business intelligence systems of the organization so that they've got that single view. What is their impact? What is their performance? How are they changing patient care?
Welcome to the Scale Healthcare Technology and Innovation Podcast, where we explore how innovative technology is revolutionizing U.S. healthcare. Hosted by Jason Schifman, president of Scale, we sit down with industry leaders to uncover the strategies, breakthroughs, and technologies shaping the future of care. Join us and subscribe as we dive into the cutting edge of healthcare innovation.
All right, welcome to the next episode of the Scale Community Healthcare Technology and Innovation Podcast. Pleased to be joined by Pelu Tran, the CEO of Ferrum Health, a company that's doing some interesting things in the adoption of clinical AI across the healthcare provider landscape. And so looking forward to learning more this morning. Pelu, welcome, and thanks for being here.
Great meeting you, Jason. Thanks for having us on.
So before we get into specifically what Ferrum has built, maybe if we can start with a sort of a macro landscape, what's the problem and sort of the context that you were looking to solve for and improve upon by building what you've built at Ferrum?
Yeah, so our company's kind of inception was really a lot of the frustrations that healthcare has with innovation. And the story that really drove it all was my uncle who passed away from lung cancer that was missed by his doctors over the span of several years. And that cancer could have been found with AI tools that were available on the market that would have cost his doctors pennies to use. But unfortunately, we are in a healthcare system that really struggles to adopt these technologies. And that lack of adoption has real costs. Right? Millions of patients per year who are receiving suboptimal care, having their diagnoses missed, having their care delayed because their doctors don't have access to the tools they need. So Ferrum was founded with a desire to try to make it easier, safer, more secure for hospitals to be able to deploy these tools and for patients to ultimately be able to be using and benefiting from the AI tools that are out there and really transforming the world in virtually every industry but healthcare.
And how has Ferrum, with that context, how's Ferrum gone about achieving those objectives?
So we come at it first and foremost from a healthcare lens. So we come at it first and foremost from a healthcare lens where we think about why hospitals aren't adopting AI, and we try to solve those friction points. There are a few that come to mind out the gate. AI is extremely data hungry and presents some major security issues to hospitals when they deploy it, needing to send your patient data to every vendor you want to work with in an ecosystem where there are over 1,000 different solutions out there really doesn't seem like the best way to protect your patient data. The existing systems that hospitals have to work with are oftentimes legacy. They're on-prem. They don't really operate in the sort of cloud capabilities that we're used to as technology providers. And then there's a real risk around the governance of these models in terms of safety. Virtually every AI tool, just by virtue of the population it's trained on, is going to be biased or drift in some way. And that's okay if you're just trying to do like lead qualification for a social media campaign, but it's much harder if you're actually trying to find breast cancers that may look very different in a minority population than they do in other populations. So there's a need for secure deployments of these models in a way that protects patient data. there's a need for there to be a consolidation of the many different vendors that are out there into shared compute, shared integration, so that you're not dealing with a one-to-many problem at hospitals. And there's a real need to make sure these tools are monitored and governed safely across the organization. All of this converges into this fundamental concept of full AI governance over the entire life cycle, where hospitals are not only having tools that can manage the discovery and deployment of these models, but actually the ongoing monitoring and replacement of them as technology advances.
So I think about the process sort of from a selection of which AI tools and solutions make sense for my organization, my hospital system, the implementation, and then the oversight. And it sounds like Ferrum plays a role in each of those phases. Is that right?
That's right, yeah.
Does Ferrum have AI solutions of its own, or are you helping to organize, implement, and oversee other third-party AI solutions?
The latter. And so you can think of us as the AI governance partner to hospital systems that helps them make sense of the universe of AI tools that they're trying to work with.
So before we get into the details, because I think maybe walking through a case study of how Ferrum plays in each of those phases, selection, implementation, and oversight with some specifics, where are you seeing the greatest adoption of AI technology within the clinical ecosystem?
AI has in healthcare kind of been synonymous with imaging for the past, call it, decade. And I think that's just by virtue of where AI has been the most mature. So over 80% of FDA cleared models today are imaging. That doesn't necessarily mean radiology. It can mean pathology, cardiology, orthopedics, or others. And so that's been where most hospitals have been adopting AI. Imaging files are unique in that they are extremely heavy and large. They oftentimes require very short turnaround times, and they uh, pose a, again, one-to-many problem where a single image may need to have multiple applications run on it. So it's been a great initial area for us to focus on solving some of these problems for hospitals. But even when you look ahead, you look towards the generative AI boom, where you have agent bots, you have all these different new language-driven models that similarly run on GPUs, have hundreds of different use cases that hospitals need to deploy, you run into the same governance problem. So I would say historically, it's been a lot of diagnostics, a lot of measurement and imaging-centered applications that have been on the market. But going forward, that problem and that AI ecosystem has broadened considerably with these next generations of AI tools that touch on even more data sets and even more types of use cases.
So let's stick to that sort of three-pronged approach of selection, which AI solutions work best for my organization, implementation, how do I get them up and running, and oversight, how do I govern and measure results. So coming back to the first of selection, how are you curating a pool of third-party applications? If so, how many applications fit in are within your ecosystem? How do they make their way there? How do you select them? Give us a flavor for what that work looks like.
Yeah, so it's informative for this to talk about what's been done so far without Ferrum. And that's really been to look to FDA clearances and sort of the regulatory bodies that are out there to try to help hospitals figure out which tools to use. Unfortunately, that's been lacking. And the large majority of solutions that are on the market actually perform significantly different when used in the real world compared to when they're being approved. And that's actually something that's different between AI and other sorts of medical treatments, right? Like diagnostics, drugs are things that if you run a clinical trial on a patient population, you can be somewhat confident that it'll perform similarly in the real world. AI is not the case, right? The type of scanners you have, the patient population you have, even things as minor as hanging protocols or workflows that you operate with can change the uh, performance of an AI model. So something like 81% of all FDA cleared solutions perform more poorly in the real world than they do according to FDA clearance. And so that burden falls very much on the shoulders of hospital systems. So Ferrum comes in, as you mentioned, we're a convener for AI models. By bringing transparency and allowing hospitals to actually measure and validate these tools, that actually contributes directly to that first part, which is model discovery and selection. We're not an open marketplace. We try to work with the market leaders in any given category of AI solutions. And the most important part of model discovery is that we make it really, really easy for hospitals to be able to test new models without needing to go through the entire multi-quarter process of onboarding a new vendor, because we have that platform that they can use to support and host these tools. Our hospitals will look to their peers in terms of models that have worked for other health systems on the platform. They'll look to validation that we do for these models on their own population. And then they'll really look to some of the work that we've done with these vendors, ensuring that their validation studies are accurate, that the populations they're trained on resemble the hospitals that we're deploying at, and ultimately even oftentimes testing those models within real world environments so that when hospitals use them, they know that there's been something more than a single research study or a white paper that is supporting those AI developers' claims.
So how many applications are in the ecosystem today?
North of 70. And I think it's a sizable percentage of the use cases that are in the market today.
And what is the process for one of these companies to be included in your ecosystem? Do they have to go through pilot testing and validation prior to being listed? What is the criteria for being able to be part of that?
Yeah, there's definitely curation. I think it comes in two forms. One is really making sure that models aren't just available on the market and approved, but that there are actual real use cases that they are solving problems for. And so there's a business case, there's a clinical case that needs to be built for these tools that we run by our hospitals. We meet with our system partners on a regular basis, and we work with them on figuring out what the ROI and what the value prop is for different clinical models. A surprising number of tools in the market don't really have a clear value proposition, either productivity or clinical outcomes or business ROI. And so a good amount of them are filtered out at that point. From there, there is, as I mentioned, internal validation and testing that we do of these models on data sets that we have at our customers and independently. And that independent validation is something that we definitely hang our hat on in terms of being able to have a lot more confidence that these models are going to work for hospitals before we curate them onto the marketplace. At the end of the day, though, the proof is in the pudding, and the only true way to understand whether a model is going to perform on your population is to validate it on your population. And that's a really important role that we play for our system partners.
So I have, as a CEO of a health system or a large MSO, I've got this library of 70 pre-vetted, curated solutions that I can pick from. So I noticed looking at that catalog that breast imaging is one area that came up a few times. So let's just use that as an example. So let's say that's relevant for my business. I can rely on the work that Ferrum has done to find several different vendors in that space, pick the one that makes the most sense for me. And I think so. I've checked one of the boxes that CEOs frequently ask, which is I want to experiment in the space, but I don't know where to get started, and there's so many vendors out there, so I don't know where to begin, and I don't know who's trustworthy or not. When I get to the next phase of implementation, is that implementation phase being led by Ferrum? Is that curated through your organization, or is that now I'm turning to the third party adoption? And how much easier is that implementation phase by working through the Ferrum platform versus working directly with a third party?
Yeah, so this gets to the security concerns I mentioned earlier, where right now, if a hospital wants to work with a new vendor, they're usually working directly with that vendor under its own contract, its own integration, the own vendor's cloud, and there's patient data flowing out and back into the hospital system firewall. Now, that presents major concerns, as you might imagine, from a security standpoint, where you've got patient data flowing to all these different vendor clouds. But it also presents major issues from a cost and performance standpoint, where there is additional complexity spent when you're having to move patient data around, especially large files like imaging. And there's additional cost that comes with that, as well as reliability issues. So when I said we're a AI governance platform, that includes governing the infrastructure. And so we're actually providing hospitals with compute either in their cloud or their data center that they can use to actually host these models themselves. So patient data never leaves the firewall. These models are all held privately within the hospital's environment, and eliminating the risk to patient data and the performance issues that arise from needing to work with each individual vendor's cloud environment. This, by the way, also presents some major benefits to the vendors as well, right? They no longer have to spend margin on supporting cloud costs, first-line support, maintaining integrations, all these different things in healthcare that really, if you're an AI company, it's not your day job. And so we do it better, cheaper, faster, and more scalably than any individual vendor ever could. And we do it for the hospitals within compute that they control to ensure the safety of the models that are being used. So we truly are a kind of soup to nuts partner to the IT team, from the compute that's being provided to the integrations that we help them manage, through the actual running of the applications on the right studies at the right time with the right urgency, and injecting those results back into the right endpoints and workflows that the hospital needs.
So another key piece you mentioned was sort of where the who owns the compute, and it sounds like with the Ferrum solution that sits on the company side or on the client side. With a lot of these third party applications that might sit outside the company's firewalls, the data's got to leave the organization to use the application. Am I getting that right? And is that necessarily the case with third party applications? Is that how most of these applications are being deployed today?
Yeah, the overwhelming majority of these applications are being deployed via their own cloud environments. Really, that is one of the biggest challenges with securing AI deployments.
We, so would you say, we've covered now the selection part and the implementation part, and I'm getting a sense in the implementation that a big part of this is having one centralized platform to monitor and roll out these solutions, and the second piece is a key element of security. And so is the core value prop of Ferrum more so in a governance and security lens, or more so in the selection of picking which applications are worth spending time on from a clinical application and effectiveness perspective?
It's the latter, though there is, of course, an element of discovery and selection that has to be included. I mentioned earlier that the only way to know if an AI tool works on your population is to run it on your population. The challenge is that without Ferrum, it takes hospitals hundreds of thousands of dollars to be able to do so. You need to approve the vendor to access your patient data. You need to set up the integrations. You need to sign the contracts. You need to do all of these things, just to run a single study through a vendor the way that traditionally works. So model discovery is part and parcel of what we do, but it's not the interesting part, because really, there are plenty of marketplaces and resellers out there that can have a vendor on the catalog. The challenge hospitals have is not having a catalog of vendors, is actually figuring out how they're going to perform and operate within your production environments.
So
and that's really where we come into play.
If your clients came with a vendor that wasn't in the catalog, you'd still be able to roll that out on the Ferrum platform. It's just not part of your pre-populated catalog.
That's correct. Yeah, and that's actually how most vendors that are being onboarded today are joining the platform, is through customers that are looking to deploy them.
So let's take a step back to sort of the macro level now that we understand a little bit about this core value prop around security and sort of where the data resides. How much of the market is adopting AI solutions with the data residing on the safer side of the firewall? And for the portion that's not doing that, how much of a risk are they taking?
Yeah, you can answer that question one of two ways, right? The first one is, what percentage of AI deployments are currently operating via cloud, vendor clouds? And that's honestly today, it's probably 90+%. But the other way to answer that is how much AI is being used in general today. And I would say low single-digit percentages of the AI models that are available on the market are currently being adopted by healthcare. So the disconnect in that, the fact that the vast majority of AI models that are being adopted are cloud, but unfortunately, the fact that they're cloud means that there are really extraordinary costs to supporting, deploying, and ensuring that they operate safely. So the opportunity here is that hospitals will be able to deploy an order of magnitude more AI, more securely, more effectively, more safely, when they are able to have control of those applications than they can when they have to follow the current mechanism of vendor cloud deployments. 90% of the market today is in the cloud. I would say probably 90% of all healthcare imaging data resides in on-premise data centers at hospitals. And that disconnect is what's causing so much of this pain in adoption on the market.
Got it. So there's a roadblock to adoption more so than a vulnerability from a security perspective.
Yeah. Hospitals are conservative. They usually catch security vulnerabilities and are not willing to proceed. And so there's a bit of a lack of action.
How about the non-hospital market? Do you see a difference in those percentages?
So like private radiology groups, imaging centers, private clinics, they typically have lower uh, friction points and requirements from a security standpoint. But I think there have been a number of pretty significant breaches and cybersecurity incidents that have happened that have made almost the entire market turn away from cloud. So yes, there's probably more adoption of these point solutions in the, call it, small to mid-sized practices part of the market, but that's a shrinking part of the market as healthcare consolidates, and even they are increasingly looking to secure their AI deployments.
And so, given that this is a platform and it's meant to accelerate and reduce the cost of adoption of AI solutions, is there an inflection point that if I only have one application, this is overkill. But if I am deploying across 10 different departments, my women's health, my OBGYN, my urology, my cardiology, all of a sudden this starts to make a lot more sense, or should we be thinking about it differently?
Yeah, I think for folks that are only thinking about one application, they're going to be implementing that. There are going to be costs involved with that. And really, the reason why they're probably not a fit for us is not so much because there isn't a major savings to deploying VS even for that first application, but it's actually probably because they don't fully recognize how painful it's going to be. So anyone who's deployed an AI solution already has recognition of all the cost, all the pain, all of the different steps and burdens it places on their team. Usually that's why folks engage with us at the 2 or 3 application mark, because they've done it once and they have learned that they never want to do it again. So it's not 10, it's not one, it's probably that 2 or 3 mark of AI applications that folks are looking to deploy. And that's out of the average hospital system probably has dozens of AI applications that are being requested by their doctors in any given month or year. And so they're already behind. And if they are still on the first app, there's probably reasons well beyond demand that are driving that.
Well, actually, that's a good point to even just double down when we say the number of applications. So I think there's when I think of a health system, I think of lots of different departments, and so you can get to 12 different applications based on one application per 12 different departments. When I think of other portions of the market, if I'm a single specialty urology player, single specialty cardiology player, non-health system, am I still going to need 12 applications, or do I just need the one urology application that's relevant for my specialty?
Um, you're going to want more. And I think I mentioned we have over 70 different use cases on the platform. Out of the 1,000 that are on the market, there's a lot of overlap. And so one of the real challenges is healthcare has historically operated on these 10-year buying cycles for technology. So you buy an application, you expect it to operate for 10 years, and you have a new cycle to replace it at the end of those 10 years. AI operates on a month-to-month cycle, where the best AI vendor for a given use case is never going to be the best one in a year or two from now. And so the refresh cycle for these AI tools means that having a governance platform that doesn't just help you deploy tools, but actually as technology evolves, allows you to compare updates, competitors, new solutions on the market uh, in that same environment, eliminates vendor lock-in, which when it comes to AI, with how fast it's moving, with how many different vendors there are, it could pose a killing blow to hospitals if they don't have their hands wrapped around it sufficiently.
So we talked a lot about selection and implementation and the benefits of a centralized platform and the benefits of the security. Let's now focus on the oversight component. So what does it mean to oversee a portfolio of AI applications, whether it's from a security perspective, whether it's from an operational perspective, whether it's from an ROI and effectiveness perspective? How much of that, what does it mean? How much of that runs through Ferrum? And what do your clients get in terms of intelligence coming out of the system from this ongoing oversight?
Yeah, so I think anything less than full visibility into AI performance is doing your patients a disservice. So the way that it works today is hospitals will look at an AI vendor, they'll look at their shiny brochures, they'll talk to a few of their peers, and then they kind of just have to trust that that AI tool is going to be work the way it does. a few sites, the Hopkins, Harvards, Mayos of the world, they'll actually run a exercise where they'll generate a data set, they'll kind of have their doctors label it, they'll send it to the vendor, they'll ask for results back, they'll do that initial internal validation of these models, but that's an extremely labor-intensive process that really only academics can do. So the alternative to that is just crossing your fingers, hoping it works well, and then asking your doctors a few months later if they still like it. That just isn't going to fly in healthcare, given how sensitive these workflows are and given how these vendors' performance differs. And so what we do is we actually give hospital systems a way that they can run these models without needing to buy the entire package. They can test them on their own population. And we actually automatically will validate these tools on their population based off of data that's already in the EHR, right? Like patient records, notes, labs, etc., so that they have a crystal clear view of how any AI model is going to perform on their population before putting it in the hands of the doctors and potentially impacting patient care negatively. So that truly gets at the heart of this concept of AI governance, where if you're going to be using AI to connect your entire enterprise, you're going to be permeating AI insights throughout the organization. uh, you have to have an ability to monitor it the same way you monitor every other technology solution. And systems don't have that today, right? They have their Tableau dashboards, their Power BI dashboards that they're running the business on. And then they have these AI models running in this little corner of the shop, making critical decisions, but none of those outputs are being integrated into the patient's care pathway, outcomes, ROI, in a way that actually allows for enterprise governance of these tools. That's what we provide. We bring all of those AI results. We combine them with automated ground truth that our platform is able to generate off of the patient record. And then we actually incorporate all of that into the data strategy and business intelligence systems of the organization so that they've got that single view, not just of what are the AI tools running, but actually what is their impact, what is their performance, how are they changing patient care.
So an analytics layer on top of the third-party AI applications to measure results.
That's correct.
And are the results that you're thinking about, how do you frame results? So you can frame results from a financial perspective, from a productivity perspective, which dovetails on financial, from a clinical outcomes perspective. Are all those perspectives included in the way that you're thinking about analytics, or just some?
Yeah, so all of them are, and we bucket it into IT, clinical, and administrative. So most technology companies, most AI operations companies focus on the first, IT, which is, are the GPUs running? What's the turnaround time? Is the model causing errors? What is its ROC curve? Kind of a lot of these IT focused items of uh, analytics and monitoring. What's missing is the connection of the AI model's outputs into the reality of the care the patient's receiving. So I mentioned how we actually connect those AI results into the actual decisions that are being made to show the health systems the actual clinical impact of these models. Right? Is this breast cancer algorithm actually finding lesions that ultimately end up being breast cancer? Are they finding them at the same rate across Black, Asian, or white populations, or is there a difference there? Even things like, are these AI tools working the same way in our prized tertiary care centers with a residency program as they are in our rural clinics where maybe there's a physician shortage? Things like that, those sort of questions on the clinical front are critical to be asking if hospitals want to be able to know how to use these tools, but really nobody has the level of data science capability or the clinician time required to label these studies to actually arrive at those insights. So they need a partner that connects the dots for them. We do so both clinically and in terms of business ROI and business impact. And I think that's kind of what's been missing from the space is analytics that go beyond IT.
How do you handle the customization for the different clinical specialties? Because measuring results is not an easy task. It's not an easy task in the non-AI world. It's not an easy task in the AI world. It's customized to each specialty in terms of which metrics matter and how to think about results. Number one, how do you handle that customization? Number two, are you coming with pre-populated ways to think about results for these specialties? Are you working with your clients to build their custom ways of thinking about things?
Yeah, it's got to be pre-populated. We're fortunate in that most of the current applications of AI are diagnostics, so they're usually classifiers that are trying to find some lesion or measure some part of the body. And so those you can get a ground truth off of them from the patient record, clinician notes, downstream care pretty easily. I can tell pretty clearly whether a patient ends up with a breast cancer uh, off of the patient record without needing to do too much fancy tap dancing. Uh, Once we do that once with a new application and an account, we can then scale that and bring those insights and bring those frameworks to other accounts and other vendors in the same space. So there is some initial build that needs to happen for any new use case to figure out what ground truth means from a business and clinical standpoint. But once we've figured that out for an application, those insights and that process and framework can be used pretty easily by all future sites and be used by our vendors as well, who oftentimes struggle to figure out how they're supposed to justify impact or cost without platforms like us.
What does it take to maintain the Ferrum platform over time? So I'm imagining this portfolio, and there's sort of an IT, administrative, and clinical operational component to it, just like you said. Does the client need to have fairly robust infrastructure and teams to support each of those three functions from an AI perspective? Are they working with Ferrum from a ongoing professional services perspective in depth, or give us a flavor for what that looks like?
Yeah, so we pride ourselves on being white glove. I think no hospital really has the capabilities to robustly manage and govern AI. I think many of them are setting up these AI councils or AI committees, but that's just to try to even just triage which AI applications are being requested. So the actual IT teams, the clinical teams, the business teams, data science teams, they're all already stretched super thin. And so I feel like our view here is that hospitals need true partners that can help them carry the water across the entire stack. And so, we'll actually provision and manage hardware for hospitals that need it. We'll actually handle and manage the GPU compute that's residing within their private cloud for them. They have to set up a single integration to our platform, but so long as that integration is open, we're actually the ones that are handling the data munging of which studies go to which algorithms on which timeframes. And we're the ones that are actually helping them identify when maybe a new site that they are setting up causes an error with their AI applications, or maybe a new update that got pushed doesn't work on some of their machines. All of those sorts of call it analytics and white glove support we consider as part of our core business. And as you might imagine, doing so for 10 different applications is a lot easier for us to do managing a single platform, single integration, than it is for a hospital managing 10 integrations, 10 compute environments, 10 different contracts. So there's significant simplicity that gets introduced into the AI governance at hospitals by having a single platform that covers technology, infrastructure, interfaces, integration, tracking, support, and even validation and monitoring of these solutions.
Is this a buy versus build question, or is this truly incremental technology? So, for example, my RCM department, I can build internally, I can choose to outsource it to a third party, pros and cons to either option. Just off the top of my head, I think of AWS or Microsoft Azure. I'm never going to build what AWS and Azure have built. I have to purchase that and consume that. So is this, if I'm a sophisticated hospital with the right IT department, I can manage for all these things, or are all these hospitals going to need some type of solution like a Ferrum or a comparable solution in order to roll out effective AI?
With everything that's involved in governing AI effectively across, call it all of the solutions that they need to be deploying, I think there are fewer than 10 health systems in the US, probably fewer than five, that are going to be able to do that, right? Like the Mayo Clinic platform is a great example of a technology platform being built by a health system. Mass General Brigham has their own institutes around this. Um, Other centers of excellence are staffing up 10, 15, 20 data scientists cloud engineers, integration engineers, compliance experts, security experts. It is possible to stand this all up, but it's going to cost a health system millions to tens of millions of dollars to be able to get to 10, 15 applications being supported. And so it ultimately comes down to like, is the juice worth the squeeze for anybody in healthcare? And I think that when you compare that multi-million dollar cost to even just start playing the game, I feel like the vast majority of hospital systems are choosing to take it slow and deploy AI solutions one at a time over the course of years rather than try to make the investments to be able to change that trajectory. So for us, it's very much creating a new category, showing health systems, hey, listen, you don't have to spend millions of dollars and become a AI data science expert when your primary job is to deliver patient care, when you have partners like us that can basically give you that AI counsel, that AI governance in the box from end to end, so that you can literally just tell your doctors, hey, listen, we're working with Ferrum now. You can turn on any solution you want. We can make sure it's safe and works, and we can have it running in a matter of a few days to weeks rather than months to years.
Yeah, and I mean, I'm thinking about even in terms of just data analytics. If I have my own data analytics team, I still need to build a data warehouse, and so there's still some technology component of it, even if the internal team has manages that data warehouse and builds the visualizations on top of that data warehouse. So it sounds like
Totally.
maybe there are a few different ways to use Ferrum. One is the core technology platform, and the other is sort of the ongoing analytics. Are customers able to buy in that way, or it's a bundled solution?
It's bundled. I think different customers want different aspects of it, but no one really has a true handle on the clinical and business performance of their AI tools. At most, they may have validated it once when they first implemented it. They might have kind of ongoing surveys and feedback, but they don't have the visibility that they should be having into how these tools perform.
And what's the footprint today? How many clients are you working with today? If you can give us a sense for the pricing model, that would be helpful as well.
So we're platform as a service. So think of us as a percentage cost on top of their cloud compute or their existing IT compute. And that comes at a fraction of the cost of, again, what they would be spending otherwise. I think our view is a lot of the way similar to a Plaid or a Shopify, where we feel like building these reusable platforms and tooling are things that any one player is never going to really want to build to the same level of complexity and ultimately will save them time. So we're able to offer a platform at a much lower cost and percentage of their IT spend than it would be if they were to do it themselves.
You've mentioned a number of items that talk about sort of the industry adoption of AI technology in the clinical ecosystem. So you mentioned that there's a lot of players out there offering different solutions, and there's a high level of overlap. You've talked about the security risks associated with adopting technology if it's not done appropriately, or this gap between being able to access the data and the security requirements to do that. You've talked about the cost of building internally, and you've talked about the receptivity to change and the pace of adoption being fairly incremental or sequential, I should say, so one at a time. When you add all that up and you look at the results of these AI solutions, what are your predictions about the market going forward in terms of, do you see a rapid acceleration of adoption of AI from the health systems? Do you see it continuing to be slow and steady, but not necessarily a massive acceleration? And then on the supply side, from the vendor side, what are your predictions about that landscape given the dynamics you mentioned?
I think AI is being accelerating in its deployments over the past several years. So it's been really picking up because of all of the generative AI models and all the agentic models that are out there. So there's a whole new class of AI tools that are being launched. I think you're going to continue seeing that be the case. The barriers to actually building highly performant imaging models has also continued to drop. You see folks that are actually now releasing foundation models that cover every diagnosis in a given category. And so I think you're going to continue to see the friction to build new models that have value drop. And as a result, you're going to see the number of different applications that are available for clinical use continue to skyrocket. So that, from an AI standpoint, that is inarguable in terms of where the future is headed. From a hospital standpoint, I think that it really is a world of haves and have-nots, where individual hospital systems are operating at that 1, 2, 3 application mark, and they're seeing the maintenance costs of those bespoke integrations and deployments starting to take up more and more of their IT bandwidth. And so every additional application that a hospital deploys directly actually removes capacity for them to be able to deploy applications going forward. So folks that are deploying it directly, you're seeing kind of a declining rate of adoption of AI over time, where they're just focused on maintaining the tools they already have. Folks that are deploying platforms, you're seeing an accelerating rate of AI adoption over time because the demand's there, the value's there. The reason why they're not being deployed is a lot of what I mentioned before on friction, activation, energy, maintenance costs, reliability of the algorithms that just are not being solved unless hospitals think about it from a systemic standpoint and think about what it truly means to build that AI connectivity across the enterprise and sorts of partners and platforms they need to have in place. So I think you're headed for a complete divergence. And hopefully what that means is more systems that are currently in the do-it-yourself mode are now popping over into the platform mode as they realize what's happening.
I bet on the vendor side, on the application side, do you see a significant consolidation ahead, given that there's a lot of overlapping solutions in the market, or do you think the spirit of innovation will drive just a rich ecosystem of vendors for the foreseeable future?
There's already consolidation. It's already happening, and it happens in every space. But I think for every one company that we see get acquired or merge or go out of business, you're seeing 10 pop up. So that's only going to continue being the case. And I think it's only going to continue being easier and easier to build AI models that are going to be more and more valuable.
I noticed all the focus is on the clinical side in this conversation, and in my understanding from the website of what Ferrum offers. Why the focus on clinical? Do you see the Ferrum moving into the non-clinical space, or is that just considered not germane to what your core value prop is?
So one more time.
The non-clinical space, so things like call center, things like revenue cycle, other applications outside of the core clinical functions of these health systems.
My answer for you now is different than my answer a year or two ago, and it's because of the rise of generative AI. So historically, those sorts of solutions haven't really needed GPU compute. They haven't really needed the sort of, call it, deep learning infrastructure and data capabilities that have been required. Oftentimes they could run a CPU, they're kind of bag of words or rules-based engines that are solving a lot of those problems. That's completely changed over the past few quarters. And so now the same use cases that might have just been a tiny little revenue cycle application running in some virtual machine in some corner now requires GPUs, it's running Llama 3, it's doing 15 different things much more successfully than these applications of the past have at a much higher level of accuracy. And so administrative tools, documentation tools, agents, EHR summarization, clinical trial matching, like all of these use cases that never were really AI problems have now become AI problems and require the same governance, require the same infrastructure needs as AI of the past. So one great example was I was talking to one of our customers at HIMSS this year, and they were talking about how they have had 20 different agentic AI company meetings at HIMSS. And they were saying this one company just does a chatbot agent for patient loneliness in our home care sites.
Mm-hmm.
How the heck am I going to integrate that one agent into my broader strategy alongside the other 15 different use cases I need to be supporting? So even the agentic generative AI universe of applications is already becoming fragmented. You're already seeing one-off point solutions being deployed. It's exactly the same problem that we've been having in the imaging space for the past decade. And I think folks are looking at ambient listening, they're looking at these big logos, Abridge, Nabla, Ambience, and they're saying, oh, cool, like we got scribing. But then, great, you've got scribing. Well, what about after that, right? What about the next 20 applications that you're going to be wanting to use for patient care for generative AI that you're never going to be able to actually implement in that same way? So exactly the same problem. We provide the same solution. We support those applications the same way we support the imaging tools. I will say the validation and monitoring is a little bit more complicated for those sort of tools. You're usually looking at things like identifying hallucinations or making up of information rather than simple classification exercises, but there's still a real need for governance and monitoring as well.
Is the security value prop as relevant in that as acute in these non-clinical spaces, or is that mostly focused on the clinical side of the house?
If you're talking about like no patient data whatsoever, not a big deal. But you're talking about very data hungry applications. ChatGPT, Anthropic, all of these are models that have very unclear data governance themselves in terms of how they're going to use your data. Usually they think about it in terms of, well, we'll never have identifiable information that you send us, but we reserve the right to aggregate or distill or summarize it. And so if you're a hospital and you're uploading sensitive patient data or even administrative data to one of these cloud providers of AI, like there's a real risk there for your organization from a data security standpoint. People have pretty consistently been able to show extraction of information from these agents in a way that should be terrifying for anybody working with them. And so the future, I think, has really been demonstrated by what DeepSeek came out with, which is open source models that are fractions the size of these massive models that have the flexibility to be fine-tuned and adjusted to your local needs and can be run securely within your own environment. Like that's really where the future of enterprise generative AI is going to go. It's going to be these fine-tuned local models that don't require a deal with the devil for your data with some of these big players.
So we get asked by CEOs, like, as I mentioned before, all the time, where to begin on adoption of these technologies. And I think if I were to paraphrase this conversation or summarize this conversation, I think you would say that that's the wrong question to ask. That there is no silver bullet on the broad universe of AI applications in the market. I think what you would say is number one, try several, because when I said about one application versus 12, you have a bias towards more applications that are relevant in the ecosystem. And two, I think you would say the right starting point is to begin with the right governance tool, both from a security perspective as well as the application effectiveness measurement perspective. And then, as long as you have that right foundation, experiment, which is a different perspective and I think a different way of thinking about the adoption of AI than, frankly, most of our counterpart organizations, our clients, our CEOs are thinking about the adoption. I think we spend most of our time working with the point solution and thinking about what's the right point solution for my business. So if I'm getting that right, that's the question. But that's just an interesting nuance to how to think about adopting AI in the healthcare provider market.
Yeah, I think that's absolutely right. And it has to do with this fundamental question of if a system is actually thinking about what it means to be an AI connected enterprise, where they've got not one, two, three AI applications in a vacuum, but they're really thinking about, hey, what does organizational transformation look like? Now they're thinking about dozens of applications that need to be supported, and now they're asking the right questions. These AI councils that are being stood up, I think there are two flavors. One is to serve as a holding pen for all of the different requests that the CIO is getting from their different clinical stakeholders, and just serve as a way to just kind of punt the ball and say, okay, yeah, it's in queue, right? It's in the backlog, and essentially use it as a way to stave off progress. I think that's probably at least 2/3 of the AI councils that we see. And then the last 1/3 is actual councils that are given the authority for transformation by leadership. They're kind of viewed as a way to accelerate, not to slow down AI adoption. And they're looking for tools for governance, and they're looking for tools that can eliminate the sort of IT burden and bandwidth that's required. And so I've got to believe that more and more systems will start looking more like the AI councils that are supposed to drive growth by healthcare conservative. And so we'll have to see how long that takes.
I want to squeeze in one more question, just because I think this last bit is interesting in terms of just how to think about adoption in the market. So I get the platform, platform first, and I get the value prop from a security and just ongoing operational and effectiveness, governance, and measurement. But I'm trying to also reconcile that with the need to have customized ways of thinking about how these solutions are performing. And so breast cancer different from, or breast imaging different from cardiology imaging. Imaging different from call center applications of AI, different from RCM applications of AI. And so one of the pain points in the market is how fragmented the end application market is. And you're solving for that by bringing it all together. And yet, in order to effectively bring it all together, you need some of that pre-populated analytics that matches these these point solutions in the market. How do you reconcile those two things? How do you stay precise enough on the analytics to match the point solutions while also being broad enough to be the centralized and holistic governance platform?
I would actually flip it on its head, which is you should not be trying to figure out how your AI tools are performing in a vacuum. Any AI tool you deploy as an organization should have some impact on either clinical outcomes, business productivity, clinician workflows. There should be a business impact to these AI tools that you're deploying. And systems are generally decent at measuring things like wait times for MRI machines or how long it takes a radiologist to return a study. Like the operational metrics that hospitals are currently running their business on should be affected by AI models they're deploying. Otherwise, what are you doing deploying them? So our view is you need to be taking these AI models outputs and figuring out how you can actually measure their performance, of course, on an individual level, but you need to be thinking about, hey, what are the endpoints? What are the end metrics that these tools need to be driving towards? And let's actually connect these tools outputs into that. So actually having the AI results fed into whatever Tableau, Power BI, Health Catalyst dashboards you have, and measuring its impact. A great example of this is breast cancer, you mentioned, where recall rates of screening mammograms is a really, really important metric for mammography programs, where you want as low of a recall rate for screening mammograms, because when you call them back in, you biopsy them, and you get all these other additional testing, like it's not a good experience for patients, and you want as few of those negative recalls to occur as possible. Hospitals already have this data, but what's missing is when I turn an AI solution on, how does it affect my recall rate, and how does it affect the ultimate rate of cancer diagnosis? And by being able to feed in what the AI is calling into the recall rate by site, into the rate of cancer diagnosis, we actually have a direct visibility into the impact that AI has. And obviously, what we see is AI reduces recall rates, so fewer patients are coming back in for follow-up imaging to figure out what's going on, but increases cancer detection. So actually, we're finding more cancers with less intervention because of this AI tool. And it's stark that you see they turn the AI on and the charts diverge.
But wouldn't they see that in their Power BI, their Tableau reports? What are the incremental analytics that are required that are not able to be accomplished? So for example, I have two sites. I run the pilot at one and I don't run the pilot at the other. And I can compare the recall rates at those two sites. I know which has the AI tool, I know which doesn't. Let's assume that they both started from a similar recall rate. All that resides and still will reside in the client's Tableau. What's the incremental analytics that is the missing piece that Ferrum is solving?
Yeah, well, if they can run such a precise study, there's something to be said there. But it really comes down to, okay, cool, like that when you turn it on, something changed in your organization. Great. Do you know why? Like, was it because your detection of cancers in Black women rose, and was the AI a result of that? So I think the AI outputs, you need to make sure that they are being delivered safely, and you want to make sure that they're not biased, and you want to make sure they're performant. But then I think that connectivity into the downstream, like there are a lot of important questions that need to be asked as a follow-up to that very, very simple. Maybe you see recall rates drop, cancer detection rates rise, but you do still need more information on how.
A richer
Yes,
analysis.
yes,
It's
exactly.
almost like an imaging. You've got your X-ray, your CAT scan, your 3D imaging, your color imaging, and your multi-layered imaging, and each shows a different level of detail. And it sounds like a much more multi-dimensional analysis relative to what you would typically get in a Tableau. That makes a lot of sense. I want to thank you so much. This is extremely informative, and I think really a good primer in terms of what the market is going to be thinking about in terms of adopting AI and how Ferrum can be helpful. So congratulations on what you built, and enjoyed learning a bit more today, and I appreciate the time.
Thanks, Jason. Likewise.
Take care.